German drug maker BioNTech has unveiled a mobile vaccine production unit meant to bring vaccine manufacturing to Africa this year. The facilities are actually made of shipping containers, and BioNTech says it will begin establishing a mobile center in Rwanda or Senegal first by the middle of 2022. Ghana is also likely to see a facility. The unveiling was attended by the heads of government of those three nations, as well as the chief of the World Health Organization. Well, BioNTech has been criticized for refusing to open its patents to other manufacturers, but it said today it would not pursue legal action against breaches of those patents. Our correspondent Christine Mundwa was in Marburg, Germany, for the presentation of those new production units and tells us more about BioNTech's latest move.
Less than 1% of vaccines that are distributed in Africa are actually produced on the continent. And that's just one illustration of the extent to which Africa relies on other countries for the supply of medicines. Now, this initiative by the German pharmaceutical BioNTech is effectively the export of mini labs. These are shipping containers fitted with the technology and the equipment needed to manufacture vaccines locally. It's not the patent waiver that many in the global south have been calling for, but it has been hailed as a significant step in terms of progress towards getting Africa to be able to produce more medicines locally on the continent. The presidents of Ghana, of Senegal, of Rwanda visited the BioNTech facility here in the German city of Marburg, and they said they were pleased with what they saw. These are the recipient countries that will be receiving some of these containers or these mini labs, so to say. Just to give you an extent of what the situation is right now, in the pandemic, we have heard a lot from people in Africa about the hoarding of vaccines. As we speak, less than 10% of Africans are fully vaccinated compared to countries like Germany, where I am today, where most adults have received at least 3 jabs of the vaccine. Now, this is not going to address immediately the vaccine inequity on the continent, but it's also throwing forward to other diseases that we have on the continent, potentially using the mRNA technology to treat those. I'm talking about diseases like malaria and tuberculosis. So groundbreaking will soon begin in these 3 African countries which are due to receive these containers, and we will start seeing production happening within 12 months of that.